I'm Dr. Claire Richardson. I'm an emergency room physician, and I've been at Stevenson for roughly 8 years now. So influenza particularly generally presents with quite a high fever. People are feeling generally unwell. I describe it as sort of feel like you've been hit by a truck, just really awful without anything too specific and focal. They're all going around. Typically speaking, and they do all mix, so careful. Influenza, you've got a pretty high fever, and again, you're just feeling really rotten, joint aches, specifically your muscles are really sore. You can have some vomiting and diarrhea, but not a lot of it. RSV tends to be your babies or your extremes of age, and that's specifically difficulty breathing. It really affects your lungs more than anything else. Your common cold is going to be your head cold. That's going to be your runny nose. You can have a pretty bad sore throat. You may have a bit of a fever, but it's not very high and it's very easy to treat. And then COVID-19, that's your great mimicker. Every year it's a little bit different. Unfortunately, this year you're getting fevers again and really bad sore throats. People are presenting with quite sore throats. The other thing, you can still have your shortness of breath and your vomiting and diarrhea, but really it tends to be a sore throat, and the loss of smell again is prevalent this year. So your pharmacies have them. Sometimes they're tricky to find, but you can certainly pick up a home test from most pharmacies. The biggest thing is going to be your hand hygiene. Washing your hands regularly, using hand sanitizer. If you're comfortable wearing a mask when you're out and about, or certainly if you have any infective type symptoms, what the mask will do is stop the spread, but also stop you from touching your own face, which is where you're going to get it if you've touched something else. The biggest thing is, if it's something that you're able to manage at home, then Tylenol and Advil, if you're allowed to have it with your other medications. And that's really important to treat for your comfort. You don't necessarily have to chase the fever number, but really make sure that you're drinking a lot of fluids. Vitamin D is wonderful, vitamin C, really helpful, and lots of rest. One of the hardest things for people is that you can get back-to-back viruses. And so some people think that they have had the same virus for 6 or 8 weeks because they've been unwell for all of that time. What's often happening is you get one virus, you get your peak, you get a bit better, but you run down, makes you predisposed to that second virus. That happens over and over and over, and you just feel awful for 6 weeks. And it's a real struggle for people, but the thing to do is watch for those fevers, watch for difficulty breathing, and that knowledge that there are unfortunately a lot of viruses out at the moment. Your biggest thing is going to be your difficulty breathing or your dehydration. So if you're vomiting so much that you're unable to keep anything in your system, then definitely come back in and we can check all of that. Breathing is a big thing, especially with COVID-19 and RSV. So if you're struggling with breathing, you always come to the Emerge for that sort of a thing. Other than that, unfortunately, with all of those 4 viruses, the care that we can provide is supportive. So we treat the specific symptoms that you're having. So there's not a lot of specific treatment there that we can give other than oxygen if you're struggling, fluids if you need it. But anytime you feel that something isn't right for you, or you feel afraid of the symptoms that you have, just come on in and we can check you out.